To introduce one of the speaker, Dr. Sharda Jain. She is the director of the Lifecare Center and IVF Center, and this very informative achievements she had in her life. But the best achievement now she is having, I know that her hidden talent, that is music, and most of the time she is singing bhajans. So in a way, it is to connect with God. So we are very much inspired by you, Dr. Sharda Jain. And we keep counting the days when we meet you in the Bhajan Sandhya. So please welcome Dr. Sharda Jain. He'll be speaking on how to make the effective presentation. Never discussed before.
Respected chairpersons, my colleagues and friends. I'm an old teacher, and today I'm not going to talk on any topic related to obstetric and gynecology. I'm going to focus on something very basic, how to make effective presentation. Public speaking scares most of us, but that is something. Nothing is impossible these days. We can definitely train ourselves. It's a fact that we talk too much. This respected person had said, people like men of few words. And the doctors also like short and crisp presentations with clear messages. Secondly, we all must know our audience. किनसे बात करनी है? उनकी क्या need है? Because the talk should always be audience focused. What do they want from me? 98% of people who come to attend conferences are ordinary doctors. Only 2% people are professor types. So most of us need short and engaging presentation with clear messages, less data intensive, few clinical tips, and in take-home messages should be like customer feedback type. And that is why we are here to learn what to talk, how to talk, and whom to talk. Now, when it comes to topic, pick up a small topic for yourself, which you wish to highlight, and not the whole book. 80% people who come for conferences already know about the topic. What they're looking for latest Cochrane review, the latest guidelines by the respected bodies, and something new. Few tips, and then finally the sum up should be like key opinion leaders summing up. So how do I talk? I must talk precise, I must talk quick, and my talk should be emotional. This has helped me, this should help you too. Deliver in such a way that everything is imprinted on the mind. They don't have to refer back to the notes. You're not born orator, but you can be groomed. As far as I'm concerned, I did take part in schools in debates. Lady Harding gave me the command of 2 languages and made my basics clear, but my main grooming was done at PGI Chandigarh. They made me good salesman. I can sell anything. I was also told, practice makes you perfect. That's why you need to rehearse, and rehearse. Learn to time it. I remember very well when I made the first presentation as postgraduate, my mentor, Professor P.K. Devi said, child, you need to rehearse 100 times. You will never falter. And I think that's a message of mine to you too. Dress code, as far as we are presenting in India, everybody appreciates sari. Your hair should be also well groomed. There's scientific study now which shows that the text of your presentation is only 7%. Your voice, where you emphasize, makes about 38%, and the body language is the rest. So be 100% comfortable. Your eye contact with your audience should be there all the time. And if you can use your hands, it'll be absolutely great. In your presentation, there should be 3 to 5 clear messages. Do not paste the book when it comes to slides. Never-ending text nobody can read. Most of it called this also a crowded slide. So you ask your closest friend, once everything is ready, what is her perception? If she says it's boring, if she says it's confusing, her word are the last words. Delete extra text. Keep it simple. Talk in a very simple language. Time it. And one picture is better than 1,000 words. So make more and more visuals you should use in your presentation. The attention span of this fish is 9 seconds. The humans are worse than this. It is less than that. And that is why AOGD in this particular conference has given 10 minutes, irrespective of who are you, just 10 minutes of your presentation. There's a purpose behind that. So in the end, the talk should be personal, it should be short, more of visuals, and it should be impactful. It has helped me, it should help you too. Coming to the first example. AUB has replaced the old term DUB. The FIGO has coined the etiology and summed up as palm coin. Mirena is dominating as far as the treatment strategies are concerned because it improves the quality of life as well as it reduces the mean blood loss. So when it comes to presentation, finally, you need to individualize and strategize your things in a problem-oriented way. Mirena is great. Medical therapy has a place. Surgery is the last resort. Coming to the second example, if I have to talk right in terms of safety and efficacy of HPV vaccination. This quadrivalent vaccine has been there with us for the last 15 years since the time it has been approved by the US FDA. As for the data is concerned, of its effectiveness in adolescent, in young woman, in adult woman, the efficacy is undoubted. Zero breakthrough. Beside that, it does not require any booster so far because of sustained immunogenicity over the last 15 years. And the vaccine is safe and well tolerated. So in the end, I can say power of presentation is in your hands. If you want to make, you can make it awesome. If you want, you can make it boring. Thank you very much for listening.
Thank you very much, Dr. Sharda. As usual, I think your presentation was very good. It was not at all boring. It had given very important tips that you have to rehearse, and rehearse. As always, we were looking forward for such a good presentation. And I again thank you, Dr. Sharda, for such a lovely presentation. Now, I also thank the organizers, particularly Dr. Mala, for giving me the opportunity to introduce the most energetic personality, Dr.